Hey guys, we're going to talk about neck pain today. The reason we're going to do that is because neck pain is a big problem. People ask me pretty much every day what could be causing their neck problems. Well, there's typically four main structures in our necks that cause neck pain or that may be contributing to our pain experience. The reason this is important to know is because if we do not know the structure that is causing our pain, then we may actually be attempting therapies that could be making things worse. For example, if we have a disc pain problem, we have a disc herniation in our neck, and if you're treating it like a muscle problem and you just stretch it a lot and flexing your neck forward, for example, you may actually be creating worse problems to develop. You may be causing a nerve problem. You may experience pain just shooting down your arm or upper back, for example, numbness, tingling, or weakness in our upper limbs and our hands. So that's why it's very important to know what's causing our pain so we can decide what the most appropriate strategy or therapies to do to fix that pain problem. So in our necks, there's four main structures that contribute to our pain experience. These are, number one, the muscles. Number two, the joints in our neck. Number three are the discs in our neck. And number four, we have the nerves that come out of our neck. So muscle pain, number one, muscle pain typically is this aching, dull aching pain. It may be kind of diffuse. You may feel it on both sides or just one side. Oftentimes desk workers will experience this, or if you're driving or sitting for a long period of time, you may notice some stiffness, some achiness, and then as you sit for a longer and longer period of time, the pain starts to kind of gradually creep up into the neck, and then it just causes this aching and stiff feeling. Pain generator number two are the joints. Joints, when they're not moving appropriately, oftentimes we'll get this classic kink in the neck. You may wake up one day and then you're not able to turn one way without a sharp pain. Typically, we're going to be experiencing down lower in the neck, sometimes a little bit higher. So the one direction, you may be able to turn all the way, maybe a little tight, but then if you're turning the other direction towards that joint, because it's not moving, you may only be able to get to there without a sharp stabbing pain here. Another type of joint restriction or joint pain is when you're stretching your neck out and you're just not finding that relief, just not calming down. Oftentimes it's because those joints are just compressed, everything's just kind of squished together and not moving appropriately. And oftentimes I find that this is the case when people feel like they're being almost pushed forward, they're not able to straighten up, they just don't feel like they're able to get into the optimal position without pain or discomfort. And oftentimes we find that getting those joints to move is the key to solving their problem. Pain generator number three, the discs. So the discs are kind of like the cushions in between the bones in our neck. And when those become injured, sometimes it can cause some local pain either in the neck, usually centrally or a little off to one side. And if those become herniated, for example, that may be contributing to nerve pain, which then causes pain shooting down your arm, may cause some tingling, could cause some pain, again, shooting into your chest, even down your upper back. Oftentimes in these cases, people typically have that forward head posture, so they're going to be rounded forward like this rather than upright. This will typically be a long-standing injury that gradually comes on over time. Sometimes it'll be after an injury or an accident, say you fall on your head, for example, and then you get that pain and then it starts developing down in the arm. That's probably a disc injury causing nerve pain. Again, with this, you don't want to stretch it like a muscle because that'll actually make it worse. So those are the four main structures that contribute to neck pain. Again, the muscles, the joints, the discs, and the nerves. And then we're going to talk about those next time, different strategies we can implement to treat those affected joints. I'll talk to you soon.